conversation today is going to be around mental health and violence. And when you're talking about mental health and violence, first, before we continue with this conversation, I would like to mention that this conversation may be triggering to some people. So we can actually take caution while joining in to know that it may lead up to triggering events. But we are here to have this conversation. And one thing about this conversation, it is part of the webinar series for the, it is part of the Mental Health for All webinar series, which was previously a COVID-19 series by the United for Global Mental Health, and has been running alongside several organizations. And today we are here to talk about that aspect of mental health, which has been running alongside the Lancet Psychiatry, Mental Health and Psychosocial Support.net, and the Mental Health Intervention Network since 7th April 2020. And the purpose of this series has been to explain and share updates on relevant topics and learn more about from different people, organizations around the world on global mental health and its many intersections. And I run the Mpamira Foundation, and I'm glad that I was able to be given this opportunity to share this conversation, because it is a timely conversation, as we know that COVID-19 has actually led to us understanding more about mental health, seeking more services, but the level of violence has increased in many, many spaces that we are in. And today with my panelists, I have an amazing group of panelists who will introduce themselves as the session goes by, and we will want to get and understand this topic more in depth from their own perspective, from their own understanding, and from my own work, even as a counseling psychologist and as a founder of Mpamira Foundation that focuses on mental health at the community levels, where we also deal with gender-based violence and different types of violences. So I invite all the webinars participants to send their questions in the chat, and yeah, we'll begin the conversation. So what we will do with this first round of conversation is whenever I'll give my panelists an opportunity to introduce themselves and what they do, and then now we'll begin with the conversation. So we begin with the conversation. So the first thing that I'll start is introducing the panelists. So I'll start with Rabha. Please correct me if I haven't pronounced your name well. So maybe if you can give us in less than a minute, just a brief introduce yourself to our audience before we keep on the conversation. So we start with Rabha, and then we go to Devika, and then we go to Tabitha, and then Sally, and then we continue. We start the conversation.
Thank you, Amisha, and the pronunciation of the name was perfect. So I'm Prabha Chandra, and I'm a psychiatrist. I work in Bangalore, and my area of specialization is women's mental health, and I work with women facing violence and supporting them, and also training people who support women facing violence and developing methods to address their mental health. So that's who I am.
Thank you, Braha. We can go to Devika.
Thank you. Hi, everyone. My name is Devika. I'm a researcher and doctoral student working on gender-based violence and mental health research at Sangath India, which is a mental health research nonprofit organization in India. I'm conducting research on survivors of domestic violence, as well as young people who are experiencing dating violence in their relationships.
Thank you, Devika. Tabitha.
Hi, I'm Tabitha Mpamira. I am representing the Brave movement here today as one of the co-founders and a survivor myself, and also been a practicing mental health therapist and a doctoral student as well in psychology around sexual trauma and all kinds of trauma. I apologize, there might be some background noise during this, but trying my best to minimize it. Excited to be here. Thank you all.
Hello, everybody. I'm Sally Burnheim. I'm the Deputy Director with the Global Partnership to End Violence Against Children. I have a background in human rights and international development, and I'm super pleased to join this panel today. I'm looking forward to it. Thank you.
Thank you all for your introduction. I also apologize that there may be some background noises from my side, but I hope that I'm loud and clear so that we can continue this conversation. So I will I would like to start engaging Braham. And actually, from my understanding is that with the work that you do, would you help us understand like what are the main impacts of violence on mental health around the world? And in addition to that, what did the IPV Commission conclude needs to happen to address them? So maybe if you can give that introduction in regards to our work, Braha, as we kick off our conversation.
I think one of the main aims of the commission was to describe all the various mental health aspects of violence. And I think the review of literature, of course, revealed that rates of depression were much higher in women who face violence. But the important thing that I think the commission addressed was that in addition to just a report of violence, the frequency of violence, as well as many types of violence, actually increase the rates of mental health problems. So I think it's very important when we discuss percentages or the actual impact, that the impact might actually vary due to many reasons. And the more severe the violence, the more frequent the violence, the more different types of violence. For example, if a woman is facing psychological violence, controlling behaviors, and physical violence, she would have a much higher rate of, much higher severity of depression or any of the common mental disorders. So I think that's another important aspect. The other issue which was flagged by the commission was that women who don't have access to services, who are dealing with other challenges, for example, poverty, poor supports, substance use in the spouse, and having had child maltreatment, or having faced sexual abuse in their childhood. So if you add all the risks, the rates of mental health problems increase even further. I think one of the key things that we all should remember, and it's very important for me as a mental health professional, is that the rates of suicide seem to be definitely linked to intimate partner violence. And I think that's something is global, but particularly in low and middle income countries, in countries of Asia, it has been seen that the high rates of suicide are probably very directly linked to intimate partner violence. So to sort of give you in a nutshell, we all knew always that rates of depression, anxiety, post-traumatic stress disorder, and self-harm were higher in women with intimate partner violence. But the commission actually highlighted that you could have multiple risks. You could have other factors that enhance the risk for mental health problems. And I think that to me is the main message from the Lancet Commission. The other issue which came up was that while women who face intimate partner violence may have higher rates of depression, women who have higher rates of depression may also report more partner violence. So sometimes, it's very difficult to determine causality. One doesn't really know which came first. So it's very important. Again, the commission highlighted that it's important to do longitudinal studies, try and see what came first. Did the depression come first? And so a woman who is already depressed, who has a mental health problem, can't protect herself, and so violence increases? Or is it that she developed a problem after facing violence? So these are some of the key messages which have come up. But one thing which seems to be, universally evident, that violence, the experience of intimate partner violence is a very, very high risk for mental health problems.
Thank you, Braha, for that elaborate explanation. And I'll go to Devika, just building on from what Braha has mentioned and the impact of COVID-19 The impact of violence on our
I'm
mental
sorry. Sorry to interrupt you, but I can't hear you at all.
Can you hear me right now?
Yes, yes.
Okay, sorry for that. So I'm saying that building on from what Braha has mentioned in regards to the impact of COVID-19 and mental health and the aspect of the PTSD, the post-traumatic stress disorders that people have been experiencing. From your work, can you be able to describe to us like what causes violence and what impact has it on our mental health, especially for the individuals that you work with?
Sure. Thank you for that question. Like Prabha said, I think identifying a cause of violence is perhaps not as straightforward as we would like it to be. And so what we like to think about is what are the risk factors that lead to the experience of violence. And one risk factor that's come out quite significantly in our work has been alcohol use. And what's interesting is that our work is in two sites in India. One which is a state which has quite a liberal culture around alcohol consumption, and the other that is a prohibition state, that is that sale of alcohol is prohibited by law. And in both these sites, alcohol use is a massive risk factor for women experiencing domestic violence from their husbands. And that really tells you that, the prohibition isn't working, but also that alcohol is more effective policies around alcohol use, and looking at alcohol use as a health problem is what might really be the fix for tackling the intimate partner violence. Something else that I think creates or certainly maintains patterns of violence are social norms that accept violence. And we've seen through a recent national survey that domestic violence is seen as an acceptable part of marriages in India for many, many women in the country. And again, something that was very interesting is in our work with young people, when we interviewed young people who are in dating relationships, although they ostensibly reject this norm of violence in dating relationships, if it does happen, it's normalized or sort of justified because they say, oh, he's not a bad guy, it was just an emotional outburst. So even though the social norm is rejected, it still finds a way to sneak in into an intimate relationship. And so, these are two risk factors that I wanted to highlight. And when it comes to an effect on mental health, I think the commission lays out in quite a lot of detail the effects that it has in terms of depression and anxiety and other common mental disorders. But something that we face a lot is that women face a loss of self-esteem and a sense of community, which sort of feeds back into their mental health experience and causes them to feel quite isolated and unwilling and unable to seek help. And something else that we see in young people, again, something that Prabha mentioned, is suicide attempts. And I think this is particularly so for younger women and non-heterosexual young people who are, at greater risk of facing violence as it is. Yeah, that's it.
Thank you for your explanation. And I think it's important to notice the aspect that you brought into the conversation, the aspect of how young people, the aspect of drug and substance addictions, because you find that
I think we lost her. Divya.
Maybe Divya will have to take over.
Divya's asked me to jump in.
Okay.
Just give me a second. I think I have what I need right here. Just give me 1 second. So I guess she was saying something nice about what I said, but but the next question is for Tabitha. Could you describe the Brave movement and what has been the impact of violence on the ones you represent?
Definitely, thank you. And yes, everything you both have shared so far. So the Brave movement is very new. We're about coming up to 1 year old right now, and it's been a powerful global movement of survivors and allies who want to end child sexual violence. We have people all over the world representing as survivors, including myself, who are using their voices to advocate, campaign, and really change. We want to see a world where one day every child could be free from sexual violence, and where we could see that it actually comes to an end. And so for everybody involved have been touched by sexual violence in one way or the other, including allies. As we know, most people who do this work, we all know very personally what it feels like and the impact that has on somebody's mental health, on somebody's physical health, in the family, in the household, in what you were talking about, Devika, and how some of it has become normalized. It's part of society. It's almost every child has to go through this. So we want to see a world where this no longer happens, where not another child has to go through what I went through or what each and every survivor has gone through. So our 3 pillars are prevention, because if we don't prevent it, we'll continually work. We have healing, so those who have had the unfortunate event happen to them can find a pathway. And healing should also be a right, not a privilege. And lastly, justice. We want to end each and every barrier that gets in the way of those who have been affected from not getting justice. So that's who Brave is. And we hope everybody joins us in ending child sexual violence once and for all.
Thanks, Tabitha. I think something you said resonates with what the Commission mentions as well, which is about survivor voices and being sort of led by lived experience. So that sounds incredible. Thank you. Sally, the question that I have for you is, can you describe the End Violence Partnership and what aspects of violence do you tackle in your work?
Thank you so much. And hello, everyone again. For those who don't know us, the End Violence Partnership was launched 6 years ago this month. It's our birthday month. So we're also fairly new. It's the only global partnership, and it's the largest fund dedicated solely to ending all forms of violence against children, and represents a new model for generating change at scale. The partnership brings together 750 organizations so far, with one laser-focused mission, which is to ensure that every girl and boy have the chance to grow up in safe, secure, and nurturing environments, wherever they live or play or work or learn, at home, school, online, and in their communities, including the most vulnerable and marginalized children. This is truly a global issue. It affects children in every country, in both the global north as well as the global south, in every culture and every socioeconomic group. At least 1 billion children, that's half of all children on Earth, experience some form of physical, sexual, or psychological violence every year. And this figure is likely a lot higher because so much violence goes unreported. Despite the high prevalence, it's still largely a hidden problem. There's so much stigma and shame and guilt about speaking up, as survivors know. And I really salute the Brave movement for your courage in speaking about these issues. The good news is that solutions do exist to end violence against children. The partnership grew out of the Sustainable Development Goals in recognition of the scale of the problem and the urgent need to address it, not only to end violence against children as an important goal in itself, but also to achieve multiple goals, including those that address poverty, inclusive education, gender equality, women's empowerment, safe environments, and peaceful and just societies. The benefits of ending violence are really multiple across people's lifetime. And so the End Violence Partnership is a reflection of the collective ambition of all of our partners to build a safe world for children everywhere. and it provides a framework for advocacy, action, and collaboration. We also focus on certain forms of violence that affect children in multiple settings, notably corporal punishment and sexual abuse and exploitation of children that are both so damaging and both so normalized in a way. So that's a little bit about the partnership, and the role of the partnership is really its ability to inspire, motivate, and support the national efforts by governments and partners to scale up the solutions and build capacity to end this preventable problem.
Thanks, Sally. That sounds like quite a lot to take on. Thank you for sharing. All right, the next question back to Prabha. Given the findings and recommendations of the Commission, what do we all need to do next? Who do we need to work with to achieve change?
Thanks, Devika. And, just listening to Tabitha and Sally, thanks for the wonderful work that you're doing. It's really inspiring, and I'm sure many of us would like to join your movement as well. Devika, when people look at the Lancet Commission report, it's so big, and if people can get beyond the executive summary, that's really kudos to them, because it is. But every line has a meaning in the commission, and a lot of work has gone on into deciding on the content based on a lot of the evidence. So I think the commission basically focused on a few important areas. Much of it has already been discussed, but I think the important thing was, one, of course, that any intervention that you do, and first I'll talk about interventions and then the prevention. Any intervention that you do has to be co-produced with people with lived experience and survivors. I think that's something that came out very strongly in the commission, and I think that's it's so important to do that, because sometimes they talk about how even when you look at outcomes, the kind of outcomes that studies look at is maybe quality of life or something more soft, whereas what survivors are looking at is a sense of agency, a sense of control, empowerment, as well as self-efficacy. So sometimes it's very important when you're doing research or looking at outcomes. It's extremely important to involve survivors and co-produce interventions with them. So I think, to me, that's like a real strong message which came up. I think the other message, which is somewhat related to what Sally was talking about, and also Tabitha, was the importance of focusing on child maltreatment, because we know that child maltreatment can be a precursor to violence later in many ways. One is that men who've had abusive experience in childhood tend to perpetrate more violence, and men and women who have been, had child maltreatment in their childhood also become more victims of, of repeat victimization. So I think for both these reasons, it's very, very important to put all your money into effective methods for preventing and intervening in child maltreatment. So that's the second major thing. And the third, I think there's a lot of discussion in the commission about systems working together. I think what happens as mental health professionals, we work in one silo, and the people who are working with partner violence work in another silo, and the twains don't meet very often. And I think that is something that the commission is talking about, that any planning, any intervention should actually be done integrating mental health systems as well as people who are working in the area of child maltreatment and violence. So if I have to sort of say what are the three key messages, I would say these, among a lot of other wonderful messages and important messages, I think this would be another one. And finally, I would say, like how you said, Devika, that the importance of data, because policymakers will only believe that violence is happening when you show them data. And the fact that, for example, in India, the National Family Health Survey has shown that rates of violence are so high, and there's normalizing of violence and rates of violence in pregnancy are so high. Now, all of this is important to plan interventions. So good quality data collection, including longitudinal data, is another important way to go. So many messages, but I'm just trying to see what I thought was the most important that people should know about.
Thank you, Prabha. I think you have to ask me my question.
I don't have the thing in front of me, so you will have to say what question you're supposed to respond to.
You want to do it, Tabitha?
Yeah, I have it up here. So for you, Devika, what can others who are working to address the impacts of violence on the family learn from your work?
Thank you. What I'm feeling very good about is that the 2 points that I was going to make are exactly the 2 points are among the 3 points that Prabha made. So I'm feeling very good about that. The first point that I was going to make was also about children. I think, but I won't repeat what Prabha has already said. I'll just add maybe a little bit about what I was going to say. So I was thinking about the relationship between children and parents as a potential area of intervention, but also looking at it from a life course perspective, because we know a little bit about what's happening, the impact of witnessing violence and child maltreatment on children and the longer term effects. And the perspective that I wanted to bring in was about adolescence. So what we've seen, again, talking about adolescents who are in dating relationships in India, dating in India is not socially acceptable. Sexual relationships before marriage are considered immoral. And so what happens is young people or adolescents, they hide their dating status from their parents. And if something goes wrong, for example, if they face violence, specifically sexual violence, they are not likely to go to their parents or confide in their parents, because that would mean admitting that they've had sex before marriage. And so what happens is that they have to go from pillar to post looking for any kind of help, get possibly victim blamed and slut shamed by the police and other authority figures. And so I was thinking about how there is an opportunity to examine the relationship between parents and adolescents, sort of later in the life course, and look at that as a potential area of intervention, building trust and positive, constructive communication in the family system, where young people who are facing violence or mental health problems feel confident and open to talk to their parents about what they're going through. And the other point that I was going to make was also about systems. But again, my point was slightly different, which is about challenging the systems. So Prabha's point was about getting systems to work together. But the argument that I'm making is that some of these systems perpetuate patriarchal systems and perpetuate oppression of communities and identities that are already marginalized. And so anyone who's working in the space of violence and mental health must do so with some amount of activism. So challenging the norms and taking on those systems that are maintaining the gender imbalance and inequalities. Yeah. Okay, I guess I can ask you your question, Tabitha. Thank you for your question. What is the Brave movement calling for?
Yeah, thank you for that. The Brave movement is calling for many things, but nothing too difficult, because we're all in it to change and protect children. But the main thing, one of the things we want to change is we're no longer interested in having survivor voices as this pity voice. You've seen those conferences come together and they bring a survivor on stage and tells the story, everybody cries and they walk away and everything else continues. We want to be on the table. Nothing done for survivors without survivor voices. So one of the things we're doing is global survivor mobilization, that they become the main voices in all the spaces where decisions are being made in protecting children. We want to have our voices in resources, those who determine where the money goes, accountability, governments. We want to call on all governments. We actually just done with the G7, where we have had them actually include what we're asking for in their communique this last June. We're still in June? No, in July, this last month at their meeting. The Brave movement has been calling on them, mobilizing billions for prevention, healing, and justice, so that money we can put where our mouth is. Most governments have the right words for how we're protecting children, but how are we following through? So we want to keep them accountable. Abolishing statutes of limitation. We know how trauma affects a child and an adult. So there should not be a deadline on when they are ready to report. As we know, it takes time for somebody to get to that point if they do. And when they do, there should not be, oh, too late now, we cannot hold your perpetrator accountable. So we're working to abolish that. And one of our colleagues just succeeded in doing this in Bolivia just this last few months. So these are the things we're asking for. Also, safety online as well, right? So we want to protect children in all ways, but mostly keeping people accountable, making sure there is access for healing resources in every country, every child. If it affects a child in India, it affects a child in anywhere in Africa, North America, South America, it doesn't matter. Where a child is, they should be safe. And when they are not, those who make that impossible should be held accountable. So we're asking people to hold their leaders accountable. We're calling on governments. And so whoever's listening and wanting to do something, you can tweet G7. We have I think, about 75,000 signatures now, trying to get this petition for change so they can put all of this in there, so they can follow through with what they're saying they will do to protect children. So those are the main things we're working on right now, focusing on ending statutes of limitation, mobilizing survivors everywhere so we can call on our leaders in each country to really do what they said they will do and put their survivor voices on the tables where decisions are being made. Thank you.
Great, thank you. That sounds like a great future. Sally, my question for you is, could you talk a little bit about the work that you are doing tackling violence online?
Yes, certainly. So keeping children safe online is one of the partnership's key priority areas. Over the past 6 years, we've invested nearly $70 million with impact in more than 75 countries to build capacity, evidence, and the technology tools needed to tackle online harms against children. We've done this with partners from across all sectors, with governments, academics, institutions, researchers, law enforcement agencies, civil society organizations, and the technology industry itself to identify actionable steps to make this vision a reality. Beyond the investments from our fund, we've also conducted high-level advocacy and large-scale research programs to foster knowledge and collaboration so that we can maximize the use of the resources and ensure that the investments are meaningful and have a broad impact. Technology is really shaping the way that children experience childhood. Every half a second, a child goes online for the first time. And while this opens up a whole world of opportunities for children, it also brings serious risks. Online child sexual exploitation and abuse is the fastest growing form of violence against children. In 2021, there were more than 29 million reports of suspected online child sexual abuse, which was an increase of 35% from the previous year. And as more and more children across the globe start to live their lives online, the number of children at risk of online sexual abuse and exploitation increases. At any time, an estimated 750,000 people are looking to connect with children for sexual purposes online, posing a huge danger to the 800 million children that are actively using social media. So with our partners, we're working on urgently to create technology solutions that are helping to detect and bring down child sexual exploitation material online, as well as to provide technology tools for children and young people to stay safe online, including also understanding research to understand the multiple vulnerabilities, for example, of children with disabilities face, reducing their risk to online abuse, working with governments and stakeholders, hotline operators, to raise the capacity to respond to online violence, and using technology like machine learning and artificial intelligence to support this work and to enable law enforcement and support services to tackle online sexual violence. But a lot more needs to be done. You know, we especially need governments to play a much more proactive role in understanding the ways in which technology is radically shaping children's lives and how to keep children safe. We need effective legislation like the one recently proposed by the EU. That's really key to keeping children safe online, by regulating technology companies to make sure that they play a more active role in creating platforms that are inherently safe for children. And so that's some of the work that we are doing to protect children online.
Thanks, Sally. All right, I have a question for everyone on the panel. What would be your advice to advocates that are trying to make policy change at a national level? And all of you have already spoken a little bit about the work that you are doing, but what would be some advice that you would give?
Would you like me to start? So I think a little bit like what Devika you mentioned, and in fact everybody mentioned, that you you need to challenge existing systems a little bit. You need to get people to take more responsibility, and I think there's a lot of tokenism, and like Sally mentioned, when people are developing technology, I don't think they have children in mind. They sort of just assume this is for adults, and they never think from a lens where think about anything from a violence lens. So, and I think it's very important that everything that we do is from a lens that, will this increase child maltreatment? Will this cause gender-based violence? So I think it's a little bit about looking at systems as well as anything new that you introduce from that lens. So it's about challenging systems. It's also to advocates, I would say, it's very important for policymakers to know the impact that violence can have on, productivity, on life, on quality of life, and how sometimes fairly simple things can actually make things better. Because the moment policymakers start talking, when we talk to them about violence, they think it's too large a problem to handle. But showing to them that there are interventions which have shown results, that you can actually decrease some of these things. You can decrease the impact, you can decrease the prevalence. There are interventions that work, which are not necessarily very expensive, but it needs a buy-in from every step of that ladder. I think that is the kind of advocacy that is very important.
I can go, so we can stay in the same order. Oh, Sally, are you ready? Go ahead.
You go.
Okay. Yes, absolutely agree, Prabha. What I would add would be both and, right? So there is the people working on grassroots, where you start with the people you live with. So sometimes it's harder and takes longer to get through the systems, the long term, which is also important. But starting where you are, reaching to people according to their values, right? There's where we used to work in villages in rural Uganda, and police officers would get bribed by perpetrators so they do not do their job due to lack of resources. We know poverty, we know all the things that contribute to why systems don't work. And we would reach out to them and say, you as a police officer, you came into this work because you care about the safety of people. These are your values. How can we align with you? Versus when you come in as the, you're not doing your job, what do we do? So aligning with people's values who are in those spaces. And then two, for us as Brave movement, another thing we're trying to work alongside those people who want to make calls to action, a call to action to their leaders. So we do help local organizations write out. We're planning on having regional and continental global calls to action. So we have an African Union Survivors Task Force. We have one for Latin America. We have one for the US. And anybody who wants to come alongside will help you write out what those things are. And then we help push to get it to the right table. So that would be another way we can work together in calling on our leaders and holding them accountable. And so starting where you are, one person at a time, and also while holding the others accountable would be my response to that. Over to you, Sally.
Thank you. All very good points with which I agree. And I would just add that I think, from the perspective of the online safety of children, we really need to keep up with the advances in technology to stay current in how we address the symptoms of the problem. The technology is very fast changing, and children and predators are often ahead of the game. They're ahead of law enforcement, they're ahead of parents, they're ahead of teachers. And we've seen a huge explosion in self-generated online child sexual abuse material that children themselves are posting. And this is a huge risk. So I think we also need to focus on early prevention and to really take a public health approach to this, to address the root causes of the problem. I think intimate partner violence has a huge impact on children who experience that. And the technology, the world of technology is also helping to fuel violent and abusive behaviors among young people. So I think really looking to encourage healthy relationships between girls and boys is really, really important, from a public health perspective, from an education perspective, across multiple sectors. And I think, as the previous speakers have said as well, we need to demand that technology companies take greater responsibility for ensuring that their platforms are safe for children. And, we know that voluntary efforts don't work. We need legislation, we need governments to step in and regulate, and then to make sure that the legislation is implemented. And then finally, I would say we need more data and evidence on what works. It's currently very, very underinvested, and we need to understand better what works so that we can strengthen the responses and measure the results of the efforts that are being made by so many organizations.
Absolutely. Thank you, everyone. I just wanted to add something to what Sally said. I think that what you see a lot of right now when you when a cause becomes trendy is that a lot of corporates, particularly, your tech corporates, they appear to be very responsive, but their response is very performative. So I think the idea is to advocate for non-performative, meaningful change, right? So you can't just care about the LGBTQI community during Pride Month, for example, just something we're just getting out of recently. So I think that's something that I would add to what Sally just said. Great. All right. Next question. Which global moments can be leveraged to try and end stigma and discrimination against IPV? I think a good question after the Pride Month point.
Yeah, I can sort of come in there. I think that I don't know all the global movements that happen, but I think anything that any day that one is celebrating, or any month that you're celebrating, I think should have a gendered lens, and should also have a lens of, how can this be done in a safe, non-harmful way to everybody. So whatever you're celebrating, be it the mental health day or the, or a children's some event, or the LGBTQI, anything that you're doing, let us have the additional layer of the fact that it should be respectful, it should be not harmful, and it should be equitable in terms of power, because we know one of the biggest reasons why violence happens is because of inequalities of power. So I think if we can address that in everything that we do in terms of these large celebrations, it's very important. And also, bring out the evidence about how each of these, like for example, if we are looking at Suicide Prevention Day and talking about it, address the fact how child abuse and IPV are actually clearly linked to suicide. And so if you're doing suicide prevention, it's not just enough to have a helpline to do only intervention, but to look at how violence might be related to suicide. So, bringing that angle in everything.
I just wanted to highlight, Devika, you jumped into being the facilitator, but maybe you want to answer some of these questions too, because you are supposed to be on the panel. So I was just going to say if you wanted to go next.
Thank you. I'm actually very happy to learn from everyone else and just add something where I can, like I did last time. So please go ahead if you would like.
All right. Yeah, so would like to hear a lot from your experience as well. I think for me, what I would add is it's not a moment, right? Every day somebody is harmed. Every day, women, children, there's so much violence everywhere. So every opportunity, kind of like what Prabha was saying, is finding a way to bring that lens to it, to hold people accountable. Small conversations can change somebody's life, right? Not ignoring signs that you see as you go. I went to a conference on gender-based violence, and this woman put makeup on her eye, a black eye, and she walked around all day. They were all talking about how to protect women and children and all of that. And at the end of the conference, she came up and said, "Oh, then nobody asked me what happened to my eye," as we are all gathered here talking about gender-based violence and intimate partner violence. So it is every moment, every opportunity that you see, tweeting, social media. There goes the background noise. I'll stop talking. But yes, taking every chance and opportunity to talk to people, especially men. We need to involve our men in these conversations.
Perhaps I could just add, from my perspective, I agree with Tabitha 100%. I think we need to take every opportunity. There are many formal days related to different issues, and I think all of these issues in many ways cut across each other. I just think that we do need to make sure that we're using our voices to speak out for those who don't have a voice, like children, like people with disabilities, like people who are marginalized and discriminated against in whatever way. And no matter what the issue of the International Day or, the debate or the discussion, it's really important that we bring those voices to the table and make sure that they're on the agenda and being considered. I just think that there's multiple opportunities all the time for us to ensure that that the voices of children and women and marginalized groups are heard. And especially, as we see the current crises in the world are really increasing the risks and vulnerabilities of children and people to violence. It's fueled partly by technology, but also the current threats of COVID-19 and isolation, climate change, growing in food insecurity. These are all having an impact on increases in violence. And I think it's very urgent that we recognize this.
Devika, I'm going to ask you the next question from the Q&A. Because I think you have a lot of experience in that. And that's about trauma-informed care. There are questions that, we talk a lot about trauma-informed care. What do we really mean by it? And what is it that people need to be trained on, in the context of trauma-informed care?
Thanks, Prabha. I wouldn't say I have a lot of experience, but I think I would say I wouldn't have a lot of professional experience, but I think the experiences that we've had have been quite impactful and left quite a bit of a mark. And I think, again, trauma-informed runs the risk of becoming one of those buzzwords that everyone likes. But in real practice, it's really hard work. And it's, for me, I think it's about compassion, it's about empathy, it's about being able to sort of, what empathy exactly means, put yourself in the shoes of the person that's that's going through something bad. And when we talk about, for me, the systems that are currently present in India that are responding to survivors of domestic violence, for example, they are not at all trauma informed, because the way that they're looking at your survivors are as people who, with suspicion, with the exact opposite of empathy. And what they're kind of, the experience of trauma is being examined from a perspective of suspicion and doubt, rather than looking at it as a health problem, or as something that the person needs your assistance with. And that's something that I know that you've done some work in as well. But so for us, it's easy to sort of look at other people also and say that your response is not trauma informed. As someone who's also trying to examine other people's responses, our own response comes into question, right? How are we trying to make sense of what survivors really need? What is the lens? What is our bias when we come into the picture as mental health professionals? And how do we develop a better understanding of what trauma-informed really means from a survivor's perspective? So for me, if you're in a state of crisis as a survivor, and my response is to, deliver a psychological first aid, and that's my sort of trauma-informed response. But if that's not what you need, if your first need is shelter, or if you're very, very worried about your child, that's something that needs to, that I need to inform my response with. So I think that I can't give you a very technical response to this question. What I can tell you is that there's a lot of scope for collaboration and for heroing survivor perspectives in really defining what it means to be trauma informed as service providers.
Yeah, thanks, Devika. I think that was a very good response. I'd like to hear from Tabitha about, what would the Brave movement think of as trauma-informed care?
Yeah, absolutely. And I think they've covered most of it. The only thing I would add to the really great answer would be being trauma-informed is understanding how the event that was traumatizing affected that person and where they are in that process. And so that's where we find people, and I love that we shared this in the chat, that this could be triggering. So understanding that let's say, for example, I will keep using the sexual violence, especially on children, knowing that memory is affected once you go through something traumatic. And usually they'll end up going to the police and they're asking for details and really questions that are still triggering before the person is even gone to a point of understanding what just happened to them. The body's still in shock, right? So being trauma informed is understanding how is their mind affected, how is the body affected. Some people would be shocked. Stigma comes from not being trauma informed, where they say the questions some people ask, did they say no? Did they run? We understand there is a fight, flight, and freeze. Those are all responses that somebody doesn't have a choice on how they respond. They just have to survive that event. So being trauma informed in any situation, be it you are the caregiver or you are in the forensic side of things, is understanding what do they need in this moment, how is their body and mind reacting to the trauma, and how can I best support them so we can move through this process of healing. So that's what we'll do. And part of our website, we've added guidelines. If you're disclosing, what would be the best way, what not to do if you're the person getting those. So those are ways in which to help others understand how to support survivors as they go through this process.
Devika, you want to go ahead with Sally, would you like to talk about how we can be trauma informed with children particularly?
Yes, just one thing to add, on top of what the others have said. I think all very good responses, but I think everybody's experience is different, and every child's experience is different. And I think it's really important to recognize that, there's no one solution or approach, but it is very much about listening to the individual and, really providing a safe space for the individual to open up. We know how hard it is for children to speak up about, about their experiences of sexual abuse. Some recent research that we've done has found that, one in 3 children told a friend that they had experienced sexual abuse online. One in 3 told nobody, and not a single child had reported it to authorities or a helpline. So I mean, if even adults, we know, as the Brave movement has really shown us how difficult it is for adults to speak up about their experiences as children. How much more difficult is it for children to speak up? And I think, really trying to understand and listen to children is so important.
Great, thank you, everyone. Prabha, do you want to answer this question before we do the last question?
No, I mean, I think everybody sort of, responded. I would just add respect as one of the major things in trauma-informed care. I think it's very important to respect the survivor's experience and her strength and her weaknesses and whatever she's gone through. And the fact that she's reached you, it's not easy to reach a support system. It's very hard to navigate that space and to actually have the courage to come and talk to you. So I think being very respectful of the person and her experience at every stage. The other thing I want to add is very often the professional may be trauma informed, but all the people she has to deal with, the clerks, the security guard, so everybody in a system needs to ensure that they are trauma informed and not just the profession.
Thank you, Prabha. All right, the last question. I'd like to invite each of you to respond to the statement. If you want to end violence and improve mental health, you need to. Prabha, you want to go first?
I would focus on gender transformation in societies and also reduce inequity. In the context of IPV, it would be gender inequity and power imbalances, but also any kind of power imbalance, like the adult-child power imbalance. So I would like to transform society for it to be more respectful to each other, and particularly focus on gender transformative interventions.
Wonderful, thank you. Sally?
I would say that we urgently need the awareness and the political commitment, legislation and funding to address the issue at the scale that's needed.
Great, thank you. Tabitha?
I'll keep mine simple. Is just be brave and break the silence. So #be brave, and we've called all our leaders to do the same.
Wonderful, thank you. It's going to be tough to follow that, but mine was to think creatively, work collaboratively, and act quickly. But yeah, that brings us to the end of this panel. Thank you, everyone, for sharing your work and your experiences. This has been a really, really wonderful learning experience for me. I'm very glad I got to moderate this quite unexpectedly. Thank you all very much for being very cooperative. For everyone who's listening, the next webinar is on suicide prevention on Tuesday, 30th August. And I've been following the chat, and I see that a lot of people are interested in continuing the conversation. Please do take the conversation to social media. There's a lot that remains to be said and done. And I'm sure everyone on the panel will be happy to engage with you and answer all the questions that you have. Thank you very much.
Thank you, Devika, for the wonderful moderation, and thank you, everybody else.
Thank you.
Thank you all.